Good afternoon, everyone, and good morning for those of you that are joining us from the West Coast. Welcome to the Prime Magellan RX Medical Pharmacy Trend Report webinar that we do annually. We're so excited to share with you today some of our insights of our 13th edition of the Trend Report. And this is the industry's really only resource that includes an analysis of medical benefit drug claims. It also utilizes data benchmarking, it evaluates current management strategies, and it includes forecasting. If we move to the next slide, here we are. All right, so I am Kristen Reimers, and I am a clinical pharmacist responsible for driving the clinical strategy for our medical pharmacy business. Joining me today, I have two esteemed colleagues, Laura Walters, who also is an outstanding clinical pharmacist, and she really loves to problem solve, and she does that by diving into the data. So that's one of her sweet spots. Along with that, she has time when she's not working to spend time in her garden and grows bushels and bushels of vegetables and unique flowers, raises animals on her farm in Ohio. John Gunter is also on with us today. He's an actuary and a fellow from the Society of Actuaries. He knows our spend data and the spend trend data in medical pharmacy upside down. And in his spare time, to play soccer on the weekend. And he has two dogs, one of which he adopted earlier this week. One, and her name is Sarah. So I'm very busy as well. All right, so diving into our medical pharmacy trend report, I have one housekeeping item that I'd like to start with, and that is that we will have time at the end of the webcast to answer some questions. So if there's anything that we're saying as we're talking through this webinar that you have questions on, please use the Q&A button on your screen and you can type in the questions and we will get to those at the end. We'll make sure we dedicate some time for that. So in our report this year, the 13th edition, we have analyzed all of the data from calendar year 2022 across the commercial, Medicare Advantage, and Medicaid lines of business. Now, within that, we allow for 6 months of claims run out to adequately represent those final and truly paid claims data. Within that, we've analyzed HCPCS codes, about 1,063 to be exact, HCPCS codes across the medical pharmacy benefit in the outpatient places of service of the physician office, hospital outpatient, and home infusion settings. We've also included some of the key insights from our health plan data survey, which represents 56 million lives from health plans of varying sizes across the country. And then, as in past reports, we've compared 5 years of claims data from 2018 to 2022, which when you look at these trends in some of that 5-year data, you can really see some of the impacts of some of those new and innovative therapies that are coming to market in areas such as oncology and rare diseases. The rest of the analyses within the report, aside from the 5-year trend, really examines year-over-year trends, taking a look at how there have been changes from the previous year. All of this data is drug spend only. It does not include rebates, and it does not include administration costs. There is one analysis in the report itself. We're not going to be covering it today, but that one analysis looks at the overall cost of administration of drugs, and that is by place of service. So whether it's in the physician office, hospital outpatient, or home infusion. And then new to our report this year, we really took a much deeper dive into some of the insights and some of the trend drivers at every level within the report, trying to understand what it was that was contributing to those overall trends. We also took a focused look at therapeutic categories and trends within oncology for breast cancer and multiple myeloma, and how that differs across some of the different lines of business. We also took a look at autoimmune category and broke it down to the unique diagnosis codes, whether it's psoriasis, rheumatoid arthritis, or Crohn's disease and ulcerative colitis. And then also examined the true impacts that biosimilars are making on drugs within the medical pharmacy space. So since we are focused on the data from 2022, I wanted to take a quick look at some of the drug approvals, because you'll see the impact of some of these drug approvals from 2022 in some of the data that we're going to present today. So there were 49 total approvals, and 40 of those approvals in 2022 were specialty drugs. 31 of those were on the medical benefit. And you can see here on the screen, 15 of them were in oncology. 5 of those 15 in oncology were biosimilars, and there were also a good portion of, obviously 10, new molecular entities, things like some of the CAR T therapies, like Carvykti for multiple myeloma, or some of the BiTE therapies like Lunsumio, and there was also Kim for uveal melanoma, very specific and targeted cancer therapies, which really leads to impactful for all of the patients and members that are using these drugs and have a need for some of the therapies. We also saw approval of 5 rare disease therapies, things like Vyvgart for generalized myasthenia gravis, as well as Zynteglo beta thalassemia. And within all of that, we saw gene therapy. There were 5 unique gene therapies, 2 mentioned already, Zynteglo, Carvykti. There was also Hemgenix, Dona, and Estiladrin, which was also approved. And those are in some of the overall trends. And we're tracking forward very similar in 23 with the FDA drug approvals already. There's been approvals in 2023, with 42 of those being on the medical, and some of the important GPs for hemophilia also been approved now in 2023. All right, so looking at the 5-year trends, you can see here that there has been really tremendous growth, especially in the commercial space, where the PMPM trend has increased by 28% in commercial and 21% in Medicare. And there's been a lot of contributors to that. Most importantly is oncology, and that is across the board across all 3 lines of business. We focused on commercial, where it seems most dramatic, where you can see the PMPM increase from 2018 to $12.34 up to $17.99 for commercial in 2022. So that's almost a 50% increase in overall oncology trend. And one of the key contributors to that was that was approved originally in 2014 for advanced melanoma, but since then has received 43 approvals. One which was earlier this month on November 1st, there was an additional approval, and that has led to that overall of 300% in terms of Keytruda. So then when we start to move into some of the year-over-year trends, if we go to the next slide, you can see here that we have year-over-year trends, and we've combined the forecasting, and you can see that that flattens out. So John and Laura, what are the comments that you can make with regard to some of these changes, and what should anyone who's working in the healthcare industry be aware of as you're looking at this kind of forecast?
Yeah, thanks, Kristen. So I think looking at the year-over-year trends provides a really interesting look at how volatile, it's been kind of the last couple of years. It's been a little bit of a roller coaster where prior to COVID in 2019, we had very positive trends, but then in 2020, spend and utilization really kind of dropped off from where they've trended historically. Now, I know it's probably no surprise that that happened to anybody, and I promise we're not going to talk too much about COVID in the rest of the presentation, because I'm sure everyone is a little bit sick of hearing about COVID. So going forward, we're mainly going to focus on what has driven spend up in 2022 and what are some of the key things to keep an eye on going forward. So one of the common themes across, that we'll get into more on a later slide concerning the trends that we see in 2022 of 13, 4.5, and minus 1.6% was a significant change in the underlying drug mix. And again, we'll get into more of that on the next couple of slides. But Laura, for a look at the upcoming horizon, like what are some of the key things that you think professionals should keep on their radar?
Yeah, it's kind of interesting to look at and deeper dive and into what we expect over the next 3 years. Overall, the trend for medical drugs in 2023 is looking kind of flat in the per member per month for all 3 lines of business compared to some of the years we've seen in the past. Most of the new approvals from the pipeline for medical pharmacy are really not expected to make a significant impact to the overall trend. However, if uptake of some of the new drugs like Leqembi or Briumvi are a little more than originally forecast, this could alter the forecast. Therapy categories that are driving the forecast in 23 through 25 include oncology, which will continue with its positive trends due to sustained increases from the top drugs, Keytruda, Opdivo, and Darzalex Faspro, and rare disease, which will be higher trends from the drugs like Tepezza and Vyvgart. If we break down the forecast by line of business detail a little bit, the top spend therapy for commercial is going to be oncology, which will show a similar trend to the overall trend for commercial. Keytruda is still forecasted to be the leader in PMPM gains. Other therapies like Crohn's and immune globulin show consistency to that in the recent historical spend data. Rare disease shows the largest positive trends, while Neulasta and Remicade will continue their 22 trend with the largest declines in PMPM spend. Oncology is the top therapy in Medicaid as well, but has slightly lower trend than the other lines of business. Rare disease and hematology and substance abuse disorders have the largest percentage gain for Medicaid. Sublocade is unique to Medicaid as a top 10 drug with projected sizable positive trends. Gene therapies are most likely to have the largest impact on Medicaid's trend. For Medicare, oncology is more than half the spend. It's similar to commercial. It has consistent positive growth, which is led by Keytruda. Unlike the other lines of business, ophthalmic injections contribute to the forecast is significant. The therapy is relatively flat for currently marketed drugs, but pipeline may lead to a slight growth. Rare disease and hematology have some of the biggest trend numbers, and even though they're not in the top 5 currently. So let's take a look at some of the trend components.
Yeah, so this page is one of my favorites in the report because of the interesting dynamic that it highlights across the different lines of business. So when we look at the cost trend, to me, what that really suggests is happening across the lines of business is we're seeing a substantial change in the underlying drug mix for each line of business. Most of commercials, 13.5% total trend is driven by utilization, whereas for And then the cost is basically flat. But if we look at Medicare and Medicaid, we kind of see a little bit of a different dynamic where utilization trend is actually negative in 2022, but there's much more positive cost trend ranging from 5 to 6.5%. So very different dynamic across the different lines of business, but the common theme is that there's a significant change in the underlying drug mix. And I think, breaking this down into various annual cost per utilizer categories, which that detail can be found in Figure 6 of the published report, provides us with some really interesting insights as to why this change occurred. The common development across all lines of business was that drugs or therapies costing in excess of $50,000 per year per utilizer saw substantial increases in utilization and the number of utilizers in 2022. The key difference between commercial and Medicare and Medicaid, however, is that the drugs that drive a majority of your claim volume, those lower cost, high frequency drugs, also saw significant utilization growth in 2022. So this category of drugs, generally costing less than $1,000 per utilizer per year, accounts for more than 80% of total utilization, but only accounts for 6% of total spend. So when these drugs experience pretty explosive rates of growth, when you look at the cost per claim in aggregate, it's going to cause it to be basically flat and kind of neutralize the growth in utilization when looking at the aggregate cost per claim that we see on those very high cost therapies. Medicare and Medicaid, what we observed was a completely different dynamic where utilization of the drugs that drive claim volume continued to decrease in 2022 from 2021 levels. So because those high cost therapies continue to see increases in the number of people using those therapies, that's going to cause the cost per claim to be quite a bit higher than those 2021 levels where it's much lower because those lower cost drugs comprise a larger proportion of the total claim volume. Now, one interesting thing that I think we observed for Medicaid was that in total, these high cost therapies costing in excess of, again, $50,000 per utilizer per year, in total for Medicaid, we saw increased utilization at that level. But there were a few extremely high cost drugs that Laura's going to talk a little bit about later on a later slide, where we saw substantially fewer users in 2022 of those therapies. So that was a major contributor to why the total trend for Medicaid is actually negative. But Laura, do you want to talk a little bit about some of the major therapies that are driving the drug mix change?
One thing when people look at this slide that they may wonder, well, why, the big utilization and cost differences in each line of business. So I think it's kind of good to dig into that a little bit, that detail. So the variation we feel is largely caused by the patient demographic differences on these lines of business. So for example, Medicaid is generally a younger population, and you'll see higher utilization of drugs for RSV, for instance, like Synagis. Commercial is more of the working class population age demographic, and therefore they're going to have larger share of cancer drugs and MS therapies. Medicare, I think most people know, your elderly population, they see higher utilization of the vision sparing drugs like Eylea. So these things can really influence the outcome of trends. So taking a look at this slide, there's been a large increase in the use of hospital outpatient administration and commercial over the past 5 years. Because the costs in the outpatient hospital setting are about 2 to 3 times higher than other sites, this is a concerning trend. The increase further reinforces the need for site of service programs to help control any unnecessary costs. However, something to consider as part of the increase is the drug mix and population could be leaning more towards those that cannot be administered outside of the hospital due to potential side effects and special administration requirements.
Yeah, and so the numbers that we're showing on the chart here represent the percentage of total utilization year over year that is going through a hospital outpatient setting and how that's changed for each line of business over time. So we can see for commercial, that change from 2018 to 2022 has been pretty remarkable, going up about 10%. Medicare over the last 5 years is up about 2%, but down from 2020 and 2021. And then Medicaid has kind of remained relatively flat over the 5 years. But like Laura mentioned, because hospital outpatient is typically a more expensive administration site, that change over 5 years has led to substantial cost increases, particularly in commercial. And where this change has really been pretty pronounced is in oncology and non-oncology drugs, both of which grew about 70 basis points in 2022. However, since 2018, oncology, the percent of utilization going through a hospital outpatient setting has gone up about 5.5%, with non-oncology going up about 10%. And I think the important thing to kind of keep in mind here is that, if we were to hold the drug mix, kind of all else equal from 21 to 22, the estimated trends would have been about 1.5% lower than what we actually observed. So all else equal, that 13.5% trend would have been about an estimated, more in the range of about 12%. So that 70 basis point change alone from 21 to 22 has a pretty substantial impact. But I think one thing to kind of keep in mind is just because this distribution is increasing over time, particularly for commercial, is what is actually happening with the true rate of growth for utilization in each of these kind of major sites. For oncology and non-oncology hospital outpatient, that growth since 2018 has gone up 21 and 11%. Whereas the utilization in the physician setting for each has gone down 1% for oncology and a whopping 29% for non-oncology. So I think the key conclusion here is that for oncology and non-oncology, that utilization is growing at a much faster rate in a hospital outpatient than a physician setting. So if we move on to the next slide, we're going to take a look at some of the broad categories of spend before we kind of get into the more detailed view that we talked a little bit about earlier. So if we break down total spend into oncology support, and non-oncology, we see for oncology and non-oncology positive double-digit trends. Oncology support is actually negative. What's really driving that oncology trend of 19.5% is it's fairly split between utilization at about 10, 11% and cost of 8% across all oncology drugs. But driving that 8% cost trend for oncology is really a change in the underlying drug mix. So the drugs that are costing in excess of $100,000 annually per utilizer saw substantial increases in the number of utilizers. And that really drives the overall cost per claim higher, despite these oncology drugs, these 7 to 10 drugs, only accounting for about 10% of the total oncology utilization. So overall, these 7 high-cost drugs alone are driving 17% of the total 19.5% trend that we see on the page. What's interesting with oncology support is that even though the total trend is negative, we're actually seeing oncology support utilization go up quite a bit in 2022, growing at a rate of 11%. And Laura's going to kind of get into that a little bit in more detail when we talk about some of the key developments in oncology in that subsection. With non-oncology, that 11.4% trend is really driven by increased usage of your MS, autoimmune, hematology, and rare disease drugs. The aggregate non-oncology cost trend, interestingly enough, is actually negative because of that earlier development we spoke about regarding increased usage on the commercial side of those low cost but very high frequency drugs that really kind of dilute the average cost per claim at an aggregate level. So on the next couple slides is where we're going to start to get into some of the therapy categories that have had a major impact on the medical benefit, and then get into some of the new specific deeper dives that we've added to the report this year. So Laura's going to start us off talking about rare disease.
Yeah, thanks, John. There are many concerns out there around the rising costs in oncology therapy. But the cost for rare disease therapy is much more on the radar these days than ever before. Just one or two claims for these drugs can have a huge impact on costs, especially for smaller insured groups where the cost is not quite as stratified. A study published in 2022 by the KZ Global Rare Diseases found that per patient per year costs of rare diseases are at least 10 times higher than that of more common diseases. Our data shows that 85% of the most expensive claims per utilizer in 2022 were for rare disease. Medicaid and commercial experience the largest trend in the rare disease arena, so we'll focus on those two lines of business here. When comparing the 2022 high cost per utilizer data to the same data just a couple of years ago, 40 to 60% of the same drugs remain in the top. What has drastically changed in a relatively short amount of time is the highest dollar amount per claim utilizer has risen 250% for commercial and 230% for Medicaid. This staggering growth in spend has payers concerned and looking for options. Why are we seeing such an uptick in rare disease spend? The Orphan Drug Act defines a rare disease as a disease or condition that affects less than 200,000 people in the United States. There are over 7,000 rare diseases that affect more than 30 million people in the US alone. Favorable government policies aimed at creating awareness pertaining to rare disease treatment is leading to increased adoption of effective treatments for rare disorders. Also, an increased focus on development of novel therapeutic drugs has facilitated the growth of rare disease drugs market. Global rare disease drugs were valued about $161 billion in 2022, and that is projected to grow to $326 billion in 2027. So John, will you give us some of the detail behind the numbers on this slide, please?
Yeah, so I think this slide is really interesting in how, we see over the last 5 years, triple-digit growth in spend across all lines of business. So, for commercial, it's grown over 300% since 2018, Medicare 800%, and Medicaid 171%. And I think one thing that really sticks out to me on this slide is if we look at the cost per claim as of 2022 on the left, we see very different results for commercial and Medicaid versus Medicare. And that's really due to the differences in the underlying mix of rare disease drugs that we're seeing utilization for. So like Laura mentioned on the previous slide, due to the cost of these drugs, any fluctuations in the number of unique utilizers of these therapies can have a substantial impact on cost year over year. In 2022, we actually saw across all lines of business, rare disease drugs experience a decrease of about 10% in the number of utilizers, compared to the prior years from 2018 to 2021, where we saw on average a 30% increase in the number of utilizers annually. So pretty remarkable growth over the last 5 years. In Medicaid and commercial, the highest prevalent rare disease drugs that we've seen include Spinraza, Exondys, Vivondys, Tepezza, and Gamifant. In Medicare, that mix is very different. Most of the utilization is comprised of Radicava and Reblozyl, which compared to the average cost per claim, to Tepezza or Spinraza is significantly lower, kind of ranging under $10,000 per claim compared to some of these other drugs that are tens of thousands up to a couple $1 million per claim. So on the next slide, we're going to highlight one of the high cost categories that's observed some really interesting changes, particularly from 21 to 2022.
Yeah, just a little bit of background on myasthenia gravis in the United States. It's estimated that it impacts 36,000 to 60,000 people. However, it does remain fairly underdiagnosed, and the prevalence is probably higher. It is a chronic autoimmune disease that affects the neuromuscular system, leading to various degrees of skeletal muscle weakness. Now, the drugs indicated for myasthenia gravis experienced substantial increases in all the lines of business. Commercial had about a 15% increase in claim volume, while the cost per claim for Medicare rose 28% and Medicaid rose 5%. John, can you walk us through a bit more detail on myasthenia gravis trend?
Yeah, so I think the really interesting development in 2022 concerned Ultomiris, which had an expanded indication for myasthenia gravis, and Vyvgart, which was one of the new approvals. When these drugs both kind of launched from 2021 to 2022, they really gained that indication and that approval. They had an immediate impact on spend for myasthenia gravis indication. Commercial spend went up 6 cents PMPM in 2022, and most of that 6-cent growth was driven by Ultomiris and Vyvgart. What's interesting with Medicare is that the total spend actually went down 6 cents in aggregate, but I think it's really important to look at the drug level, what's happening where we see a similar impact of Ultomiris and Vyvgart for the Medicare population. What's actually driving the total spend down in 2022 for Medicare is a drop in Soliris utilization. Both Ultomiris and Vyvgart added 24 cents PMPM to the total spend, but Soliris actually decreased 30 cents PMPM. And if we look at the annual cost per utilizer for these therapies in 2022, we can really see, why that happened. Soliris, annually per utilizer is about 500,000 compared to Ultomiris and Solira ranging from 100 to 250,000. So, I think that decrease in Soliris utilization for Medicare really highlights why that spend is dropping.
Yeah, John, I was just going to chime in there real quick. I believe the rapid uptake was just because there really wasn't anything until these drugs hit the market. There wasn't really anything like them for the treatment of myasthenia gravis. So that's why the uptake was really so rapid.
Yeah, it'll be interesting to see how that continues to unfold in 2023 and 2024.
For sure.
For our next therapy category, we're going to take a look at oncology, which I'm sure to no one's surprise is the single largest category for the 12th year running, and has experienced some pretty interesting changes over the last 5 years. So before we take a look at how spend has changed year over year since 2018, we first really want to talk about some of the key developments that we've seen in this therapy category. The first of which, again, I'm sure no one is surprised by, oncology biosimilars and how much of an impact they've had since providers and payers have really begun to shift their strategy more towards those biosimilars, and how they've contributed to pretty substantial reductions in cost. Just a few years ago, market share on the biosimilar, on the reference product, was upwards of 90%. As of 2022, depending on the category you're looking at, it's generally under 20%. And I think the what really helps to highlight the impact that biosimilars have had within, the various bevacizumab, trastuzumab, and rituximab classes is looking at how the average cost per claim for those market baskets has changed over time. Each of those three oncology biosimilar categories have seen decreases since 2019 in the average cost per claim of almost 40%. So I think they're really prime examples of how biosimilars can influence a market basket and help to lower the cost of care.
Yeah, and we've got some upcoming biosimilars to look forward to help even more in that category with dampening the ever-rising costs of oncology. We have Xgeva and Perjeta, both biosimilars are currently in phase 3 studies, so we look forward to getting those FDA approved.
Yeah, I think, like Kristen mentioned on, can we go back to the previous slide? Thanks. Some of the additional approvals in 2023, we're seeing Alimsys and Vexelma for Avastin, Releuko for Neupogen, and then Stimifend and Flunetra for Neulasta. Now, before I pass it to Laura to talk more about the treatment landscape and how that's changed for Keytruda, I just want to highlight a couple interesting data points. When we look at the total trends, kind of shown on the page for commercial Medicare and Medicaid of 58, 13, and 19% in 2022, a big portion of the increase in spend can be attributed to utilization in each of those categories. So for commercial, of the 58% trend, 36% alone can be attributed to increases in the number of utilizers. For Medicaid, about 18% of the 19 can be attributed to utilization. And then for Medicare, slightly under half of that can be attributed to utilization. But Laura, do you want to?
Sure, yeah. So back on the previous slide, talking more about Keytruda, it received an expanded indication in July 2021 for the treatment of triple-negative breast cancer, which accounts for 10 to 15% of all breast cancers. And before this approval, there were really limited treatment options. The use of Keytruda alone for breast cancer in commercial surged 400% in 2022 and accounted for 57% of Keytruda's PMPM growth. Second highest Keytruda trend was seen in Medicaid, where its breast cancer utilization trend was primarily driven by an increase in the number of utilizers, which was up 135%. And we'll switch here to the third thing on the slide, supportive care, and the utilization trend for Neulasta dropped double digits. The stark drop can really be attributed to a couple of items. Increases in chemotherapy options that are less toxic and don't even require the use of the colony-stimulating factor. And then the adoption of the Neupogen biosimilars, which have contributed around a 5.7% drop in the use of commercial oncology support PMPM since 2018. Even with these factors, Neulasta continues to command much of the colony-stimulating factor market share. We anticipate this will change dramatically as there's much excitement around the biosimilar on-body device that's currently in phase 3 and will significantly drive down prices in this category. So let's move on to the next slide and take a look at how medical drug spend is going to change in the oncology space. Oncology therapies do continue to evolve. New drugs are entering the market and costs are continuing to climb. New oncology drugs had a median annual cost of $32,000 in 2022 for commercial, which was up $13,000 from the previous year. More than 100 new oncology drugs are anticipated based on the current pipeline. Several concentrate on precision medicine as biomarker-driven therapies become more common. In addition, next generation sequencing technologies are predicted to escalate. According to the forecast, the continued wider use of novel immunotherapies will grow in the next 3 to 5 years, providing additional choices for cancer patients. So John, tell us what is key to know about with the spend data for oncology.
Yeah, so I mean, not for the last time where we've mentioned the number of utilizers growing quite a bit over the last 5 years, but I think that's the really common thing that we've seen with oncology across all lines of business. So it's not unique to just one line of business. It's every line of business has been impacted by this, where much of that oncology trend is just being driven by increased utilization. In 2022, the biggest driver of that commercial oncology spend going from 1506 to 1799, like we touched on an earlier slide, is really driven by those expensive drugs that cost in excess of $100,000 annually. So Keytruda, Opdivo, Darzalex Faspro, and Enhertu. The story is very similar for Medicare and Medicaid in terms of the key drugs that are driving spend. Again, Keytruda, Darzalex, and Enhertu, Kyprolis. One notable new entrant in 2022 for commercial and Medicaid that I think is going to be important to keep an eye on and see how it continues to evolve is Rylaze, which for commercial has an average annual cost of about $600,000 in 2022. And for Medicaid has an annual cost of about $300,000 per utilizer. So Laura, do you want to start off with the deeper dive into some of the disease states?
Yeah. So similar to many cancers today, breast cancer is not a single disease. Each year, more is learned about molecular subtypes of breast cancer that may impact treatments and prognosis. More women in the United States are diagnosed with breast cancer than any other type of cancer, except skin cancer. The disease accounts for 1 in 3 new female cancers annually. And from the mid-2000s, invasive breast cancer in women has increased by approximately 0.5% per year. Currently, there are more than 3.8 million women who are living with or beyond breast cancer in the US. And it's likely that each of us knows multiple people touched by the breast cancer diagnosis. It's no wonder that it's a leader for spend in the oncology category. So John, can you touch on some of the details and the trends for breast cancer?
Yeah, so I mean, I'm not going to talk too much about Keytruda just because of how much time we've already spent talking about its growth and the number of utilizers. But, one thing that I want to kind of hit on, not just for commercial, but Medicare and Medicaid as well, is that one new thing that we've tried to do with the report this year is as we're breaking down spend into the major components, we've gone a little bit further in just looking at cost versus utilization. We tried to break down spend according to utilization trend, according to the number of utilizers. So if there are more people using a drug versus increased frequency of use, and then cost breaking down into, is it changes in reimbursement, shifts in provider side of service, or is it driven by ASP inflation and dosing changes? So when we look at Keytruda, for breast cancer, most of the 80-cent increase that we see in spend, almost over half of it is driven by utilization. The other notable increase that we saw in 2022 was in Enhertu, which went up 18 cents, again, because of increased number of people using the therapy.
Yeah, so one thing that we haven't mentioned, John, is the uptick in HER2 usage. And I think that was really attributed to the new approval for the HER2 low breast cancer. And I think we saw that really go up in both commercial and Medicaid. So moving on from breast cancer, we'll look at multiple myeloma for Medicare was a top cancer trend for 2022. And multiple myeloma is a cancer of plasma cells and relatively uncommon. In the United States, the lifetime risk of getting multiple myeloma is 1 in 132. And about 35,000 new cases will be diagnosed in 2023. Myeloma does occur most commonly in people over 60, and the average age of diagnosis is 70. This is no doubt why multiple myeloma was a top spend disease for Medicare, and it increased 19%. So can you give us a little more detail on that, John?
Yeah, so I think the key thing with Medicare multiple myeloma is when Darzalex Faspro entered the scene. What's interesting is when you look at the total Darzalex utilization across the IV and the subcutaneous form, total utilization is going up. So we're seeing more than just a shift from the IV to the subcutaneous form. But Darzalex Faspro is really responsible for a majority of the spend increase for multiple myeloma because of its substantially higher cost, about $2,000 per claim compared to the IV formulation.
Okay, so I think we can go ahead and move on to the next slide. And if you want to give us a little detail on what we're looking at here, John.
Yeah, so I think this slide is really interesting in the picture that it paints when we break down spend and utilization for the top six or so drugs that really contributed to increases this year. The first of which, when we look at commercial breast cancer, what we're kind of seeing on the slide here is when you look at the top 6 drugs, they account for 23% of total utilization, but more than 70% of total spend. And in the slide, in the actual report, we have some detail on the cost per claim that really helps to illustrate why these drugs are a driver of total spend because of their substantially higher cost per claim, upwards of $10,000 compared to most other, all other drugs that are under a couple $1,000s per claim.
Yeah, and we saw in HER2 and Perjeta each, experience increases in utilization. And we feel that's due to studies that were released late 2021 and in 2022 that actually showed improvement in overall survival when these drugs were used. So I think that really was a big contributor.
So this slide is very similar to the one before, but like the one key thing that I want to highlight that's different here is that these top 6 spend drugs account for a majority of the spend and utilization. So these top 6 account for 75% of utilization, but more than 90% of total multiple myeloma indicated oncology spend for Medicare.
Yeah, and one thing I wanted to call out why Velcade's showing there at 25%, we really expect to see why the usage will probably continue because it is a first-line therapy. The overall cost is really plummeting. It was $42 per unit at the beginning of 2022. And just recently looking it up, it's at $2 a unit. So a mere fraction of what it was 21 months ago. So we will expect that to drop out of the top 6 spend. We can move on to our last disease state that we're going to focus on, which is Crohn's and UC. So Crohn's and ulcerative colitis belong to a group of conditions known as inflammatory bowel disease, or you may know it as IBD. The most recent studies estimate between 1.6 and 3 million Americans suffer from IBD. Anyone can get IBD, but it mainly affects adolescents and young adults between the ages of 15 and 35. Medications currently available alleviate inflammation and reduce symptoms, but do not provide a cure. Rather unexpectedly, our data shows that despite lower cost alternatives, Entyvio utilization in Crohn's disease and UC continues to grow and now rivals Remicade use. Remicade's utilization trend slowed originally with the approval of biosimilars like Avastin, Inflectra, and Reflexis, and then due to increased competition in the class. Skyrizi and Rinvoq were both new treatments that were approved in 2022. More recently, we've had 2 products that were approved in the fall of 2023, Entyvio subcutaneous, which is self-administered, and Omvo, which is available in IV and subcutaneous. These products could cause a large shift in this category to the pharmacy benefit. So what sticks out to you on this slide, John?
Yeah, I think the key thing that sticks out to me here is just how concentrated the spend and utilization is in this category for Entyvio and Remicade. Both of them account for 80% of the total spend and utilization. And what I find also really interesting is that Entyvio's utilization is growing at a much faster rate than, any changes in utilization that we've seen for Remicade. So Remicade continues to retain a majority of the utilization, but even as its ASP is trended downward, but it creates an interesting dynamic where, like you said, Laura, we're seeing Entyvio use uh, have quite a significant uptake, while despite the availability of lower cost alternatives relative to Entyvio in this class. So the last section that we're going to cover concerns the payer survey, where we ask several questions that are impactful to understanding, what are the topics and strategies that are important for you.
Yeah. So, these are just a few. If you would like to see all of what our survey entailed, please go to the trend report. But a top concern in 2022 for payers was the medical benefit spend and trend, which was up from number 4 last year. And apparently it looks like to address this concern, many payers are managing over 100 medical drugs via prior authorization, no matter the line of business. In addition, 93% of payers require PA for new drugs that have unclassified codes upon FDA approval. Oncology spend was at number 3 in this year's payer survey of concerns, which was actually a drop from last year when it was number 1. Looking at the top 2 strategy-driven programs from the survey, payers are or want to start utilizing regimen-based approach to PAs. The number 2 oncology management program per the payers are drug wastage programs, which ensure the amount billed for the drug is both clinically and economically appropriate. And last but not least, ultra-rare drugs cost per therapy moved up 1 spot in the payer concerns from last year. Although no legal definition of an ultra-rare disease has yet been established, this subcategory was introduced by the NIH with indications for diseases that have a prevalence of less than 1 per 50,000 persons. Due to the targeted treatments and high cost for the ultra-rare conditions, it appears payers are taking a very hands-on approach to review requests to ensure correct therapy for the right patient when the time is appropriate.
Well, thank you, Laura and John, for your very quick but very thorough review of some of the key highlights of the Medical Pharmacy Trend Report. It's amazing how quickly the time goes as you're diving into all of that detail. So thank you for that. The trend report is available online if you visit MagellanRx.com/trend report, or you can utilize the QR code that you see here on the screen. So there's a lot more detail within the report itself. We just tried to focus on some of the key highlights here, but we do have a few minutes for questions here at the end, and I've seen a couple of them come in. So one of the first ones was with regard to some of the categories that you talked about. The focus was, we heard a lot about oncology and rare diseases, and I mentioned some of the approvals in the beginning. So the question was about what other disease states contributed to the trend overall.
Yeah, I think, when you look at outside of oncology, it's pretty different depending on the line of business. For commercial and Medicaid, they share some similarities, in terms of MS is a pretty significant driver of increased spend, in particular Ocrevus, which continues to see increased utilization year over year. For Medicare, outside of, again, some of the other categories that we've talked about, like Crohn's, hematology, probably the 2 other categories that really stick out to me concern like ophthalmic injection use, Eylea, as well as osteoporosis, where that continues to grow in utilization and cost.
Yeah, and the ophthalmic for Medicare from what we're seeing so far in 2023, we anticipate that's probably going to continue to grow. So we hope that the Eylea biosimilar that's in the pipeline, I believe it's in phase 3, will get approved in 2024, so we can start bending that trend and leveling it off a bit.
Yeah, and speaking of biosimilars, that was one of the other questions that we received, was with regard to the impact of biosimilars. And we focused on oncology and where that had an impact. And there was a dramatic decrease on the one slide with regard to the use of the reference product. But the question was, why haven't we seen that kind of decrease of reference product use in the autoimmune space?
Yeah, I mean, I can give my 2 cents on that, and I think a lot of it has to do with rebates on the Remicade side. I believe that alone has driven people to maybe, or payers to leave that as one of their preferreds. And so it doesn't see the dramatic decrease that we did with oncology.
Right, as well as the ASP price drops that we've seen. I mean, it's been pretty remarkable how much of a steep drop off. I mean, if you were to plot it, over time, you'd see it's almost like a straight downward, trend as the biosimilars have come into the market. And so, they're really kind of keeping pace in terms of the cost, following each other, quarter over quarter.
Yeah, definitely competition has contributed to that. All right, one of the other questions was, what category had the largest trend?
I mean, I think that would be oncology. Like oncology, on an annual basis over the last 5 years has grown anywhere from 3 to 8%. And you might look at that percentage and be like, why should I care about an increase of 3 to 8%, compared to some of these other categories like rare disease that have triple digit growth in spend. And I think the important thing to keep in mind and that we need to tie back to when looking at any percentage increase is the dollar, the PMPM impact. Because oncology represents such a significant proportion of the total spend, about 40% for commercial, slightly over 50% for Medicare, and about 30% for Medicaid, even a year over year change of 5-8% off of a very large base of spend can have a pretty significant impact.
Absolutely. All right. Well, we don't have any other questions. I don't know if anyone has anything else that they want to submit. But if not, we thank you very much for your time today and appreciate your attention and hope that this was helpful for you. Thank you very much.